in person on December the 7th. And at this time, it is my pleasure to introduce our speaker, someone that you all know and love, done a marvelous job for this club in her year as presidency, preceding mine, but also helping to set our club apart from any other club in terms of what we do through the Rotary Foundation with international projects. So ladies and gentlemen, I give you our own Holly Seeger.
Podium. I didn't spend much time here during my year as president. And you get me back up here again and we shut down again. So it kind of seems like there's a pattern. I am going to be talking about the International Service Committee today and also our global grants and then the other work of the International Service Committee. So I am a co-chair of the International Service Committee, and I co-chair with Nick Shaw, who I believe is online, right, Kurt?
Yes.
Okay, Nick, I'm going to ask you to say a few words in a little bit. Next slide, please.
Good afternoon.
This is the members of our committee. Oh,
Hang on a second. Computer's a little slow.
There we go. These are the members of our International Service Committee. So thanks to everyone who helps with international service. Now, next slide. Okay, Rotary has 7 areas of focus. Used to be 6, it was 6 forever, now it's 7. We just added supporting the environment. Our global grants focus on disease prevention and treatment. But when you look at the focus of projects, it could be any of these projects: maternal and child health, literacy, water and sanitation. We just happen to have a niche in disease prevention and treatment. Next slide, please. So they take those 7 areas of focus and then they drill them down into 5 areas of service. So it's club service, vocational service, community service, international service, which is what I'm talking about today, and youth service, which our club also does a lot in. I don't know, I don't think that'll change with the 7 areas, with the 7th area being added. I think it'll still be the 5 areas of service because that'll fit nicely under these. But I'm talking about number 4. So these are the areas of service that clubs are asked to do. And I'm talking about number 4 today, international service. So I do get the question a lot, like, why do we do international service? Well, we're actually asked to do that by RI. That's why we do it. So we have 10 open global grants right now. I think 8 approved, 2 in the works, 3 that have been closed. 10 is the maximum you're allowed to have by RI. So we're bumping our outer limit there. Our first global grant was approved in 2017. We've done 13 grants totally, had 13 grants approved since then, and we've raised over $3 million in our total global grant funds. This is actually a picture of India. You can see Nick Shaw standing right beside my husband in the center there. Dr. Praveen Kalapara and his wife from our club were there. Nick's wife was there also. This is the dedication of our very first global grant in Raipur, India, at the Sai and Jubilee Hospital. It was a $440,000 project to put a heart cath lab in there. Next slide, please. So this is our partner for the majority of our grants that we do is the Sai and Jubilee Children's Hospital in India. This is the Raipur location. They have 3 locations now, spread throughout India: Raipur, Mumbai, and then near Delhi. And these hospitals are really unique. They provide completely free services to children, and they only focus on cardiac services. So they do diagnosis, surgery, and procedures, and then follow-up care. Not only is it completely free to the children, but they also house and feed the parents while their child is in the hospital, because these parents have often traveled hundreds of miles to get surgery for their child. And they are a phenomenal partner. So why India? Why do we focus on heart surgeries? Congenital heart defects are the leading birth defect in India. They impact about 200,000 babies each year. That's about twice the rate of congenital heart defects in America, by the way. And it's linked, a lot of it is linked to prenatal malnutrition. So 1 in 4 children will die before their first birthday if they have a congenital heart defect in India. India has, so to understand a little bit about the healthcare system in India, they have a system of private hospitals, which are second to none, absolutely phenomenal hospitals. If you have the means to have private insurance, you're getting great healthcare in India. In fact, many Americans go to India to get healthcare because it costs less and it's really good. If you don't have money, you're relying on the government hospitals. They are overcrowded, there are long wait times, and that's why we see the high rate of death is children waiting to get in for those appointments, or they're not diagnosed early enough, and we see a high death rate. So that is why we focus on cardiac surgeries, and that is why the Sice and Jiminy hospitals opened, was to help those children who are on those long wait lines. And in fact, I've seen materials come out from the hospital where they're interviewing parents who say, you know, we got a price of what it would cost to have paid for our child's surgery in a private hospital, and it would have bankrupted us. And there was no way we could have done it. We couldn't come up with the money, and Sice and Jiminy steps in and does it for free. Strategically partnering with Rotaries in India on global grants is smart because Rotary is growing faster in India than any place in the world. They give a lot of money to Rotary in India, which means they have a lot of district designated funds, and I'll talk about the importance of those. Corporations in India are required to donate a percentage of profits to charity. So Rotary is working very closely with corporations to that's a bad word, that sounds like it's illegal, to push that money towards Rotary projects. The clubs we work with in India are so organized and on top of things. We did international service in Togo. It was a little more of a struggle to work with the clubs in Togo. They were not organized. They did not respond quickly to communications. We were not doing global grants. We were just self-funding those projects, but it was difficult. The clubs in India are so on top of it. And then the Sice and Jiminy hospitals are incredibly responsive. They have to provide data for our reports, and they are very organized and very on top of it. So it's a great partnership because when you do these global grants, you have to do mid-year and end-year reports. And if you're not working with great partners, you've got a problem. Next slide, please. Okay, so previous to 2017, as far as I know, our club had never done a global grant, at least not during, I've been here 11 years. How do we get into this? So this is another picture from Raipur, and you see me there. I'm fairly noticeable. And then to the left is Dr. Praveen Kalapara, who you may know from Fort Wayne Hematology. Many of you have been his patients, I'm sure, or have had friends or family who've gone to him. It's very well known in this community. And the way we got into Global Grant was he went on vacation to Cuba. And while he was there, he met a man named Steve Brown, and he got to talking to him, and Steve Brown was talking about the work that he does in Afghanistan. And Dr. Kalapara said, boy, I'd really like to do that kind of work in India, but I just don't know how to go about it. And Steve said, well, I work through Rotary Global Grants. He was actually on the board of trustees at the time. He's the La Jolla Golden Triangle Club in California. And he said, I tell you what you need to do. You need to go to your local Rotary Club and see if they want to partner with you on a global grant. And he said, I don't really know my local Rotary Club, but I know who does. Nick Shaw, my next door neighbor. I'll talk to him. So he and Nick came in and said, hey, Holly, we want to talk to you about doing global grants. And I was, I guess the word for it would be less than excited about that prospect. We had tried to do a global grant in Togo. It fell apart. It was really difficult. We couldn't get the clubs to work with us. The club kept losing their official membership with NRI, and it was just, it was really, I didn't want to go through that experience again. And he said, you know, Dr. Kalapara said, you know, listen, we can work with the Raipur Club, they're great, we can put this together. And I said, well, how much do you want to do? So the minimum global grant is $30,000. I was hoping he'd say $30,000 because that seemed kind of reasonable. And he said, well, it's going to be about 450,000. And I remember thinking, oh God, there's no way we can do this. Because what a lot of people don't realize about global grants, it sounds great, like you got a grant, you got a match on the money that you raised, and the match is not as high as I would like it to be. So I knew there was a lot of fundraising that was going to happen for this grant, but it did. And the Riper Club did an incredible amount of fundraising. Dr. Kalapara gave an extremely generous personal gift. And we put it together and it all worked, and it was approved actually very quickly for the Heart Cath Lab. After that, we just kept going. Once we had one success, we just kept doing more and having more successes. But that's actually how it happened. Was just sort of a side conversation on vacation. Then Nick introducing Dr. Kalapara to our club, and now Dr. Kalapara and his wife are members of our club. So what are global grants? We talk a lot about global grants. I'm not sure we've ever explained them. It's a partnership between a host club, which is our Indian clubs, and an international club. We're international. They support large activities, has to be above 30,000. They have to have sustainable, measurable outcomes. And they have to fall under the approved projects, so they have to be under those 7 areas of focus. And then there's a document that very clearly explains in about 52 pages what things qualify and what things don't qualify. We focus on surgeries and equipment, they qualify. Next slide, please. So the funds come from the Rotary World Fund, the Foundation's World Fund. When you give to the annual fund, some of your money is going to the World Fund. And in 3 years, 1/3 of the gift you give is coming back to the district as district designated funds. Those are the match funds that we can use for grants. The only funds that RI will match are district designated funds. They will not match personal gifts anymore. They will not match club gifts. So the only way to get some of those World Fund match dollars is to have some district designated funds. Those aren't going to cover your whole grant. You're still going to do a lot of fundraising, and those funds will not get matched. Next slide, please. So this is kind of, you apply online. They have a grant portal online. This is one of our grants, and there's 10 areas that you fill out. Some of them are rather intensive. You have to do a community needs assessment. You have to list all your outcomes. It's a lot of writing. Next slide, please. This is a sample, but it's not a sample budget, it's a real budget. This is from one of our smallest grants, which was $180,000 for surgeries, but it kind of shows you just what goes into these grants. So we've got cash from our partner club, Harmony Iberis, which is near New Delhi. We've got cash from Fort Wayne, which is a private gift. We've got the Singapore Club coming in. We've got District 3011 coming in, which is India, with not district designated funds, but a gift from the district. We've got the Kowloon Golden Mile Club coming in, so that's a Hong Kong club. We've got district designated funds from them and then from India. So at the end, and then down there, yeah, more from, I think that's Singapore. Okay, so at the end of the day, you look at this $180,000 grant, the bottom 3, which are 10, 10, and 15, 35,000 we can get a match on. So we got 35,000 from the World Fund for this $180,000 grant. That means $145,000 worth of fundraising went on. Luckily, our partners in India are very good fundraisers, as you can see from this. And we've had really generous donations. Dr. Kalapara has donated extremely generously. But we've had other club members give donations to our global grants. They count towards your Paul Harris giving. I give towards global grants. People who like to know exactly where their money is going, global grants are a good way to give. Next slide, please. So in the works, aside from our hospital project, as you know, well, I don't know if you know this, most of you know, I used to be the CEO of Macmillan Health here in Fort Wayne. We have a project with a former RI president that we've been trying to get through for 4 years. to develop India's first health education center based on Macmillan Health right here in Fort Wayne. And then we have a number of surgery and equipment grants in the works with SICE and Unity. Next slide, please. So I'm going to show you a few pictures. This is us. If you've never seen this, this is Rotary Club of Fort Wayne in Raipur, India. We're on the sign when you go into the cath lab. We're on the sign there. That's pretty cool. Next slide, please. So they get way better attendance at dedication events than we do. This is just part of the crowd. I went to India, and as did Nick and Dr. Kalapara, and they said, we're gonna dedicate this cath lab. I kind of thought there'd be like 6 people there. And then this happened, and I was on the stage and spoke at this, so it was a little intimidating. Next slide, please. They know how to throw a dedication in India. These are local dancers. There was music, dancing, food. It lasted all afternoon. Next slide, please. These are, I always say this looks like the India Mafia. These are the guys from Raipur who are the nicest, most fun group of people you will ever meet. Here they look pretty serious and scary. In real life, they're wonderful. Next slide, please. That's our lab. That's the heart cath lab that we helped with. Next slide, please. And this is the first patient. He's 3 years old. So as much as they like to throw a big party, we started the dedication, I think at 1 o'clock, we went into the heart cath lab room, into the actual room and did a dedication. By 4 o'clock, they had him sterilized and performed their first procedure on this little boy. And the importance, so they may like to party and have fun, but they also know how to get down to business. The importance of that heart cath lab was that it allowed them to do much less invasive procedures on children. They don't have to perform surgery to fix them. They can go in and do a heart cath procedure. That means the child's recovering faster, less chance of post-op infection, and we're getting parents back to work quicker. And for these families, that's really necessary. Next slide, please. Okay, this is cool. This little boy's name is Khalid. So you may have heard this story before if you've been in the club a couple years. You remember Steve Brown, the former trustee who told Dr. Kalapara about global grants. Once we got into this pretty seriously, it's hard to raise, to keep going with these and to be raising that much money and trying to get that much district designated funds. And at the time, we realized we had to get some other districts involved. So I thought, well, I'm gonna call the guy who got us into this and get his advice. So I set up a call with Steve Brown, and he happened to be at his home in Washington State, his vacation home. And I told him, about everything we've been doing and that I wanted some advice because I knew his club ran a really big global grants program. And he said, man, what you're doing is so cool. We work in Afghanistan exclusively, and the physicians have been treating in advanced cardiac surgeries. They have no equipment. So when children have these pretty severe congenital heart defects in Afghanistan, they die. And we see a lot of children die. And it's tragic. And he said, I wish, we could do something. And I said, well, remembering my geography, Afghanistan's not really that far from India. These hospitals will operate on any needy child. You just have to get them there and get them and everything. And he was so excited. He reached out to the Jalalabad Club right away, and they identified 3 children immediately that they knew critically needed open heart surgery. And it was Khalid, who's 3, and there was a little girl and a little boy. One of them passed away while they were going through the expedited visa process, and the little girl became too ill to travel. But Khalid went to the Faridabad location of SICE along with his parents. Oh, his dad. He went with his dad. And surgery was performed. I think it was there 4 to 6 weeks before getting him ready for the surgery and then recovery. Next slide. This is Khalid the day he left. And this story is so cool to me because I think of Khalid's mom, because I'm a mom. And I can't imagine what it's like to have a child that you know is going to die, and you know there's nothing that can be done for that child in your country. And to have a knock, and I don't know how it happened. I don't know if it was a knock at the door from the Jalalabad Rotary. I don't know if it was a phone call to them. But to have someone call you up and say, your child at no cost to you and a parent is being flown to India where they will receive free surgery and be able to live a long, healthy life. I cannot imagine what that was like to receive that news and to know that it was of Rotarians in India and California and Fort Wayne who all made this happen. That family probably has no idea how that happened. It doesn't really matter because Khalid's okay, but we know it was the power of Rotary. It was the power of Rotarians, it was the power of the Rotary Foundation and the funds they gave towards this grant. That's how that happened. And since then, they've signed an MOU with Afghanistan to start training their physicians at SAIS and GBD. And I'm well aware that Steve Brown's Club will start equipment grants as soon as those physicians are trained. Next slide, please. So this is the comment I get a lot. You know, it's really nice that you do work in India. It is, it's great. But I joined Rotary to do local service. I didn't join Rotary to help people in other countries. This is some of us here. Tim was there, Lynn was there, Jane. We are delivering PPE to Lutheran Hospital. When the shutdown happened and we started getting word that PPE was really scarce, personal protective equipment for people in hospitals and other health clinics, we received a call from Sangam Charitable Foundation. You probably, other than receiving the many emails I sent you, we're not aware of Sangam Charitable Foundation. It's our local, it's a charitable foundation for the local Indian community, and they primarily do, they do a lot of charitable giving, but they primarily do arts events, Indian arts events, and they bring the Indian arts to the hour, what is that?
The Arts Lab?
Yeah, the Our Art Campus. I was trying to think the big name of the big room. And they reached out to us and said, look, Rotary has done so much work in India, and we are, you know, so thankful for the work you do in India. We would like to do a project with you to help our local community. And together, we raised $50,000 for PPE, which went to Lutheran and Parkview hospitals, Rescue Mission, Matthew 25, Neighborhood Health, Here Care got some. I can tell you of the percentage that was raised between Rotary and Sangam, the vast majority was raised by Sangam. They are great fundraisers. Their community just stepped right up and gave quite a bit of, and not only that, but a lot of the members of the board of directors are physicians, so they use their personal accounts to get the PPE because you just couldn't get it at the time. So this was a way that our international service back to help us here locally. And what I realized after all this happened was that there is no such thing as local service, and there's no such thing as international service. It is just service. We are all connected. Can you go back one slide to Khalid? And if you need any question about how we're all connected around the world, Khalid is your answer. Because Rotarians from all over the world make you phone calls and emails, make this happen. So it really was kind of eye-opening to me that I tend to say, yeah, I work a lot in international service. I'm scaling back from that now and saying, I just do service. We're all connected. Next slide, or you can skip this one too. So we work in places other than India. We just finished the crayon drive for the Medina School in Sierra Leone. I was hoping to have, I've been emailing Francis Mustafa, but he doesn't email, Wi-Fi is a little spotty in Sierra Leone. So I didn't get an answer back in time. But this is the health center that they're building. They've got the building up. They need funding for the windows, doors, and floors. And I was hoping to get a number back from him as to what they need for that. Because if anybody is interested, you can give directly to them, they're a nonprofit, or you can give through our foundation, our local club foundation, and we can collect the monies. So the results of the crayon drive, I have 139 boxes of crayons to drop off to Francis's daughter, but we also have $700 that we're sending him. So a lot of people gave cash in lieu of crayons, probably because they were on Zoom. So that worked out great because he said, this is wonderful. We have to order $500 for copybooks, and this will cover the copybooks and the shipping. So it worked out perfectly. This little boy here is our first, we dedicated a heart cath lab. I believe it was in the Mumbai location. And I got an email, well, WhatsApp message saying, please pray for this little boy. He's the first patient in the heart cath lab. He's undergoing his procedure this morning. It's very complicated. And I think it's pretty cool. These parents will never know that in America and in a lot of places in the world, there were prayers going out for their son before he went in for his procedure, which was successful, and he's there recovering afterwards. But that's one of the really cool things about these projects is it's a lot of behind the scenes work, and you're never going to get, people, they'll never know, but that's okay. And that's kind of what I enjoy about it. I would like to get, oh, okay, we got plenty of time. I would like to give Nick and Dr. Kalapara a chance to say a few words if they're still on the, maybe Dr. Kalapara first.
Yeah, Holly,
Here we go.
I'm here. How are you? Thank you for a great presentation.
Can I have you come do a reaction?
Can you hear me?
We've had him give us some verbals, but it's okay.
Can you hear me?
I put in a down for next week.
Hear us?
Give a thumbs up.
Yeah, hello. Yeah,
Hear you, yes.
thank you for the good presentation, Holly.
Thank you. And so Dr. Kalapara puts in, I don't know how many hours a week into global grants, but I'm going to say it's all his spare time. He gives an incredible amount of his free time to these global grants, so our club is very, very grateful. And then Nick.
It doesn't show anything under Parkview, but like you want to send me an
Holly, without you, it wouldn't have been possible. Let me tell you that. And the Fort Wayne team.
I put in a few hours too. Nick, do you want to say a few words?
No, I'm very much honored to be part of this project. Okay, go ahead.
And we are, so Nick was on the Zoom dedication, I think it was about 2 weeks ago, right? The Heart Cath Lab. It was really well done. So do we have any questions? Either from the Zoom room or in person, Tim?
The installation of that medical equipment, is that included in the total cost?
Yeah.
Please repeat
I'm
the
gonna
question.
repeat it. Tim asked if the installation of medical equipment is included in the total cost. Yeah, it is. So basically in these hospitals, they have the rooms ready to go when they build the hospital. So the Heart Cath Lab room is all ready to go. The room is there, it's all ready. They get the equipment, and so equipment, installation, maintenance is all included in our grant funding. And so training, anything. And I think the equipment suppliers are actually kind of very good at that. They sell this a whole package where they come in, they install it, they train you, they maintain it. So yeah, that's a total package. And it is brand new, really nice equipment.
Can I add one more thing? Can I add one more thing, Holly?
Yeah.
Rotary sends out a team to audit our grant, and this project becomes sustainable for over the years. So that's very important in this grant approval process.
Yeah, that's a good point, Nick. So the grant approval process, when the grants are as big as ours are, when you apply for a grant, they send a person out to the site to verify that that it's all legitimate, that the hospital could handle the equipment or handle the surgeries that you're funding. They meet with the physicians. That's a cadre, they call them the cadre, that goes out, and they are experts in the field that go out to vet the grants. And then they'll often do a 6-month visit also, 6 months into the grant after the equipment's installed and operating. They'll go out and make sure it's installed, make sure it's operating. And then we are required as the host club to send somebody there to verify that everything has been done properly. Now, we can't do that right now because of COVID. So what we're doing is Zoom dedications, and those are okay. And that's what we did for the last heart catalog. We did a Zoom dedication. We had a number of people from the district there, a district governor, 2 former district governors. So things have had to change with COVID. Once COVID is over, we will be traveling again to do these. And maybe need to bundle some of them because we're doing a lot of these.
Yeah. First, this was just a wonderful presentation. I
Thank
can't
you.
believe your wealth of knowledge that you can just talk about this and all these details just come out as well as the headlines. So I just want to compliment you and say, I can't believe how fortunate and our blessed our club is to have you. First,
Our baby big company for those listening.
how did you get Hong Kong and Singapore to help you? That's my first question. My second question is about how many hours a week, a month you spend on this? And my third question is, did all the dancing and the celebration at the recent dedication kind of remind you of Bollywood?
Yes. Okay. First question was, how do we get Hong Kong and Singapore? Here is the wonderful thing that people from India have a tendency to do, and that is move away from India. And so there are contacts, people who have a great affinity to India because it's their home country, living all over the world, especially physicians. 50% of the physicians who graduate medical school in India will leave the country. That's great for us. So these are contacts that, like Singapore and Hong Kong, are contacts from India who now live in Singapore and Hong Kong for the most part. And it's people who knew them. Singapore and Hong Kong have a lot of funds. They have a lot of DEF because a lot of their clubs have a $100,000 initiation fee. So if you ever complain about dues here, I lift up Singapore and Hong Kong where you have to pay $100 grand to get in. And there's a wait list to be able to do it. So
Holly, can I say some few words about it right now about Hong Kong connections? Holly. Yeah, Holly.
Yeah.
So on the Hong Kong, it was very interesting. I met this gentleman at Mumbai hospital inauguration, both one of the connections of Singapore as well as for Hong Kong. I happened to be at that meeting, and these 2 folks, the 2 gentlemen I met, I thought they were joking. And you remember that after I came back when I was putting other project together, I copied you also. And they really, and Mr. Daswani from Hong Kong, and Singapore, I had a contact by name Patel. And they really got, after we sent all the information to them, they were so much impressed. And then they have committed that they'll be willing to work with us on at least 1 or 2 grants a year.
So this is also how this happens.
Yes.
So Dr. Kalapar was at a hospital dedication in Mumbai representing our club, and he met these gentlemen who live in Singapore and Hong Kong who happened to be at the dedication. So this is what you have to be careful of. If you meet Praveen, you will be drawn into these grants. He will not stop until you are drawn into these grants, and clearly he can draw people in worldwide. So what was the number 2 question?
Was it like Bollywood?
How many hours a week do you spend?
Yeah, 3 was Bollywood, I remember that. How many hours a week do I spend on this? It depends on the week. Some weeks, I'm not gonna kid you, it's a lot. Some weeks is probably 10, 15 hours. It depends what's going on, how much I have to be on the RI, incredibly slow website. So yeah, some weeks it's a lot, some weeks it's not as much. Did the dancing remind me of Bollywood? Yes. They just really know how to throw a party in India. We have nothing on them. We need to take lessons on how to throw really cool parties. Yes, there is a lot of color and music and dancing and food, and it is just, no one entertains. You will never be entertained the way you can be entertained in India. They are incredibly welcoming, wonderful hosts. When we landed at the airport in Raipur, there were like 30 Rotarians there, all bearing flowers. I got off the plane and it was like being famous, you know, and they whisked us off to a huge breakfast they had set up, and they just entertained us nonstop the whole time we were there. It was really phenomenal.
Holly, let me add one more thing. Let me add one item that you missed. Holly became so popular in Raipur that we were invited to evening kind of thing with all the 40, 50 Rotarians in their house. And we drank so much beer that Holly's name was named as a beer company. I think they were about to name a company with Holly's name. Tell that more about how good it is, good feeling to have friends across the globe and with a lot of open-ended discussions.
It is wonderful to have friends across the globe. Yes, I'm the same in India as I am here. You all know me well enough to know my affinity for good beer. They really make good craft beer in India, and I posed for a picture for them to use for their marketing of even Americans drink Simba beer. You know, Americans to get Simba beer. So there's a picture of me somewhere holding a Simba beer bottle, smiling. Yeah. Gosh, I'd forgotten all about that, Nick. That was a great party. That was a phenomenal party. My husband slept through it. He fell asleep before we left, and I couldn't wake him up. Jet lag kicked in, and so I left him at the hotel and came back, you know, probably 4 a.m. and said, "Boy, you missed a party." So yeah, that was a lot of fun. Any other questions? All right. Well, I'd like to thank Nick Shaw, co-chair of the International Service Committee. He's very supportive, extremely supportive of our global grants and our other projects. And also, obviously, Dr. Kalapara, who has been the major benefactor of these grants. He is level 2 of the Archipelago Society now. If you know what that is, it's $250 to get in, $500,000 is level 2, which means he has given over $500,000 towards these grants. He is an incredible philanthropist. Our club is very lucky to have him. We could not do these grants without his work in India, coordinating this and his gifts, because as you can see, we do have to raise a majority of the money for these grants. So thank you. I never get tired of talking about global grants. I'm always happy to do that. So thank you very much.